Hello, my name is Shelly Sowers. I'm an instructor with UMA. I teach in the MAA MOBS program. I currently hold degrees in medical assisting, health service administration, psychology, nursing, and also business. And today we are going to talk about therapeutic responses to clients with life-altering illnesses. Let's begin with our agenda. We will contrast acute illness, chronic illness, and how those differ, as well as life-altering illness, identify typical phases of life-altering illness clients may experience, describe several psychological effects of illness, discuss cultural influences on life-altering illness, and identify appropriate therapeutic responses to chronic and life-altering illnesses. So let's get started with acute illness. Acute illness is something that happens all of a sudden. So it's something that has a sudden onset, but it typically doesn't last that long. And we're going to look at some examples. So clients with acute illness experience a rapid onset of the illness with severe symptoms, most often for a short duration. And when I think of acute illness, I think of something that comes on all of a sudden, maybe like food poisoning or a broken bone. An acute illness can be classified as an inconvenience and doesn't normally change the person's life. Examples would be a cold, the flu, tonsillitis, or a rash. So of course all would be really uncomfortable and inconvenient, and we don't like any of them, but it's not something that's going to typically alter the life long term. If left untreated, however, acute illnesses may progress into a chronic condition. Medical personnel, so as far as our responses and what we need to do and what we need to look for, we need to help the client understand any implications of the diagnosis and assist them in making decisions regarding their medical care. For example, a serious back strain can lead to a temporary loss of work. Medication treatment, physical therapy, or even an entire modification of the lifestyle or a lifestyle change when employment requires heavy lifting. And then of course there's a lot of training on ergonomics and how we need to properly move our body and things that we can use to prevent that from happening in the future. Now let's look at chronic, and you're going to see a lot of differences between a chronic and acute. So with chronic, this is an illness that will have symptoms that typically linger over a period of time, showing little change or decreased progression. While some of those chronic conditions may be cured within a few weeks or even months, many will become a life-altering and then something lasting a lifetime. So let's look at some of the effects and some of the examples. Chronic illnesses typically have a significant impact on the client, going to necessitate some type of life-altering change as they attempt to cope with that illness, comply with the treatments, whatever that may be. And there's probably going to be a lot of different types of treatments. Deal with possible side effects of those treatments. The illness may gradually debilitate, and it could also shorten their life. So some examples might be hypertension, which is high blood pressure, or high cholesterol. And we know both of those things could lead to something like a heart attack, also known as a myocardial infarction. So let's say that the person did have a myocardial infarction. It's going to happen all of a sudden, even though there was a gradual onset, right? It's been happening probably for a long time and coming for a long time, but it's going to happen all of a sudden. But once it does happen, it's going to be life-changing. The patient would have to modify what they eat, exercise regimens. They would have to see the doctor on a regular basis, take certain types of tests, medications. So what would our therapeutic responses as the healthcare professional be to a chronic illness? We have something called curative care, and it kind of says its name, curative. Cure is in that word. A healthcare practices that will treat clients with the intent of actually curing them. Then we have palliative care. That's relieving or alleviating without curing. So we do this a lot with patients that are terminally ill. We are not giving them let's say, medications to necessarily cure them. We're giving them medications to make them comfortable and make them feel more at ease. Hospice care is an interdisciplinary program of palliative care and also support services that addresses the physical, the spiritual, the social, the economic needs of the terminally ill client, but it also involves a lot of their family as well. That's one good thing with hospice is they're very patient and client oriented, but they're also very family oriented in that sense as well during that time. And this care may be provided either in the home or in a hospice center. So a little bit more about life-altering illnesses. They can be defined as an illness that affects or limits the quality of life of an individual. So let's think about that and let's say that one more time. Life-altering illness. So let's think about something that alters the life. If it alters the life, it's altering the quality of life in some sort of way, altering the quality. Some chronic illnesses and most life-threatening illnesses are life-altering. If someone, let's say, has hypertension, it's life-altering because they're going to most likely take medications and maybe be put on some type of specific diet or have an exercise routine or regimen that they need to stick to. When chronic illness progresses to the stage when death is the inevitable result, and unfortunately we do see that with chronic conditions in many cases, the illness is defined at that point as life-threatening. So at first it was life-altering, but when it's actually to a point where death is inevitable, then it becomes life-threatening. So there is a difference there. However, some chronic illnesses and most life-threatening illnesses are still categorized as a life-altering illness. So you might hear that used interchangeably, but it's important to know what the differences are. The life-altering diagnosis creates feelings of powerless and feelings of lack of control. Now, what we know about feeling powerless and what we know about feeling out of control is all of those things create anxiety in patients. It can also lead to psychological conditions, it can lead to depression, it can lead to a lot of different things. So what one of our main goals will always be with a patient that is suffering from a life-altering illness, an acute illness, a chronic illness, any kind of illness, right? We're going to empower them to feel in control and make sure that we do what we need to do to give them as much control as possible. Because as the healthcare provider, we have a lot of control. We really do. During an interview with a patient, we have a ton of control because we are in control of that interview. But we want the patient to lead that interview, right? We want the patient to be in control of their own health care. We also see here, hope should always be maintained. However, in some cases, the disease may be fought for years before ultimately ending in death. So a little bit more about the therapeutic response to life-altering illness. As a healthcare provider, a positive attitude will influence the client's progression through a life-altering illness, and this goes for every single one of you. It doesn't matter if you're in the clinical arena, if you're in the administrative arena, doesn't matter where you're at. We come in contact with these patients regardless, right? And that positive attitude, the positive atmosphere that they come into has a lot to do with their compliance with medications and with, those exercise regimens we talked about. If they come in contact with a healthcare professional that's not positive or has just a negative attitude, and they don't need that, right? Especially someone with a life-altering or life-threatening illness, they don't need that. They need positivity from everybody that they come in contact with. We're going to express warmth and caring, and they can tell if you're being genuine or if you're not. They can pick up on that. So you really try to connect with them in a way, go the extra mile, not just have a nice day, maybe ask about their day, maybe say, what are you guys doing? Where are you going after this? You guys, have a good weekend. Make sure to try to extend that out to express that you do care. Refer clients and family to illness-specific support systems. And if you are coming in contact with patients that have specific life-altering illnesses, let's say that you work at a specialty, and we know that we're going to have patients with these particular illnesses, have those resources on hand before. We don't want to be in a situation where we have a patient and we haven't researched that stuff. We want to have it on hand. So we're going to be proactive in this sense, and we're going to go out and get those resources beforehand so we can provide them to our patients. Remember that clients may be angry. All right, that is part of the grieving process. And when we have life-altering illnesses, if it changes our life, we do go through a grief process. So they may express anger, but just keep in mind, it's not directed towards you. It's really not. It might be displaced in that sense, but it's not directed towards you. So we have to really work not to take things personal. And that goes just across the board with any job. But specifically in healthcare, you're dealing with people that don't feel good. And we all know when we don't feel good, our attitude can kind of change, and our feelings may come out differently than what we intended. So keep that in mind. It's not personal, and you always need to stay professional. Some losses faced by individuals with a life-altering illness. They face a lot of losses, a lot of them. We have persons with chronic illnesses who face lots of losses, such as their health. We look at the bullet points here. We've got their health. You know, they were once healthy and now they're not. They want to feel like they did when they were younger. Or independence. We want to give them independence as long as possible. And we're going to promote that as long as possible. Body image. The body has changed. So there's going to be possibly a sense of loss of self-confidence. Relationships. They're losing relationships. Remember, especially with the aging patient, they're at a point where they're losing loved ones because they have reached a certain age where, you know, they're starting to lose their loved ones. They're starting to lose their lifelong companions, their children even. Sexual function may decline. There might be a change in that. So if that is the case, we want to make the patient feel really comfortable to be able to talk to us about it. And then we can address those concerns, right? Because we can't help if we don't know. So again, going back to making the patient feel comfortable, and if you care, they're going to open up a lot more to you. Financial security. Retirement's a really great thing. We always think about retirement. Hey, I'm retired. But for a lot of people, it's not great. They may be forced to retire because of health issues. So lots of changes. Also, if we look here in this paragraph, their daily routine is interrupted. If they're needing to get daily treatments, their whole life is upset. Their whole life is interrupted. So what are some of the psychological effects of a life-altering illness? It really depends on the experience. Everything is different. I mean, it could be something as simple as taking a medication, getting used to maybe some of the side effects that come along with it, and they may subside, or it could be something significant as having a daily treatment that you have to be at between 2 and 6 every day. It could be that life-altering. Personal relationships. Some can't cope or watch the illness effects. So in a lot of cases, I want you guys to keep in mind that their family may not be there because they simply cannot watch the changes and may almost push themselves away from the patient because it affects them in a negative way. Which, while that's sad, it's one of those defense mechanisms to not deal with the issue at that time and to try to kind of run away almost from those feelings. Some important things to keep in mind are setting personal goals, weekly goals, both long and short term. That's a really good thing with someone that has life-altering illnesses. Now, if it's more of a life-threatening illness, let's say if it's a terminal patient, long-term goals are not typically something we talk a whole lot about because it can be upsetting. If we know the patient, let's say, has been given 3 months to live, why are we talking about something 5 years from now, right? That wouldn't really be correct to do that. What we would focus on is the here and now and the short-term goals. But for a person that has a life-altering illness, if they're taking medication, doing some diet changes, let's set some small goals, realistic, measurable goals. Also, update will and power of attorney for healthcare. Those are things we need to talk about with them if they don't have them. Also, symptom control. We don't want people to have consistent symptoms that alter their life, because sometimes the symptoms can be worse than the medication. Then learn about the illness. Remember, empowerment is key. Knowledge is power. So if you have knowledge, you are empowered and you can learn about the illness and how to prevent things and different types of treatments and so forth. Now, what about cultural influences on life-altering illnesses? So every culture is going to view things a little bit differently. And all of us, everybody that's listening to me today, views this a little bit differently. And a lot of our life experiences play a role, our beliefs, our values, all of those play a role. Our culture is huge, though, as far as what we believe as we get older, what we grow up with. We tend to kind of follow that as we get older. So cultural influences and preferences must be considered. We have to consider that, such as how we feel about hearing we have a life-altering illness. I'll give you an example. If I have a life-altering illness, I want to know. I want to be told. Whereas some cultures, they do not want to be told, or they want their family present when they're told. So most Americans would like to be told if they're having a life-altering illness, so most would. They may feel it creates a sense of hopelessness, though, and actually worsen the dying process. So some choose not to go that route and don't want to hear that. However, some cultures see this as insensitive, and they do not wish to know the diagnosis or the prognosis. The prognosis is the forecast. So let's say if you have treatment with this illness, in 6 months you're expected to get better, or in 3 months, whatever that forecast is, with and without treatment, because it does vary depending on if you choose treatment or not. So such as half of the Mexican American population, the Korean Americans, they may choose not to know what the diagnosis is or what the prognosis is. They may view it completely different than what you view it as. And remember, we're going to continuously respect the wishes of the individual, regardless of what we think or what our personal beliefs are. That's not in play here. So let's look at, lastly, the therapeutic response, just kind of overall what we can do, regardless if it's an acute condition, a chronic condition. We can apply these responses with everyone. So we're going to understand the importance of cultural values and beliefs, and do not stereotype. I'll tell you, I think about this. Ageism. We think about the aging adult, the elderly population. And you kind of maybe think just initially they may be hard of hearing. Now, while that's a consideration, I know a lot of people that are older and have dog hearing. They can hear a pin drop. So we're not just going to assume that every single person that's older can't hear, and just automatically yell. We're not going to do that. So we're not going to stereotype based upon age or gender. Be prepared for mood swings and realize that these may be part of the process of coming to terms with what is happening. There's going to be those fluctuations in moods. It's going to happen. But remember, it's not personal towards you, and you always maintain that professionalism. Encourage open and honest discussion about emotions and feelings. Encourage that, and I tell my students all the time, at the end of the day, some of these patients, you may be their only interaction that week. May be the only person that they get to talk to that week. So they may talk a lot, but we have to take the time out, if we can, to talk to them, because we might be that only interaction. And sometimes just listening and understanding demonstrates therapeutic response. This is another thing I talk with students about, listening, the listening ear. Sometimes it's actually better just to listen, especially with our patients that are terminal. Just listen in a lot of cases. Include the client and family in discussions about a treatment plan when appropriate. We always try to include family. We look for what support systems the patient has. That's actually also documented in the patient's chart for that reason. We want to know what your support system is so that we can try to include them. Allow the client to make decisions whenever possible. It's their healthcare, right? They should be making decisions, and they should be able to be independent and make those decisions if they can. Discuss any worries the client has about pain or symptom control of whatever their healthcare plan is at that point. We want to educate family members about the illnesses and also what to expect, because the patient, remember, they're under a lot of stress right now. This is a lot for them. So if you can educate the family members, that's two people that we've helped to educate. And if one forgot, the other one might be able to kind of pick up the slack there and say, oh, okay, well, I remember the doctor saying this. Help the client and family members manage their stress as well. Kind of like with hospice care, what we talked about, how they always include the family, and it's a huge approach to family and the client. We try to do the same thing and deal with the present, the here, and the now. Let's deal with right now. Let's take care of what their concern is right now. That's one of our main goals. Thank you very much.